Good afternoon, everybody. It's me again, but this time wearing a different hat. My hat as a medical director of Venture Strategies Innovations. And in the next 5 minutes, and I promise I will be 5 minutes this time, I will present some of the key steps we are taking to improve reproductive health services in Rwanda. So a little bit of a context in Rwanda. It's a country that still has high maternal mortality. Abortion is very prevalent. A large percentage of women that need services for safe abortion or treatment of incomplete abortion were not getting it. And this is part of a study that Guttmacher Institute did in 2009. So in place, there are sort of a policy documents such as the roadmap to accelerate the reduction of maternal mortality. But there was one piece missing related to abortion services, given the importance that unsafe abortion plays in maternal mortality in Rwanda. So the Ministry of Health has been working since 2010 with VSI on these issues. And in 2011, the political environment changed a little bit so that the new penal code includes exemptions for abortion that I will talk a little bit more later on. But right now, let me just give you sort of a summary of what we have been doing in the last 4 years to actually move from law to policy and practice. And I will start with the comprehensive post-abortion care services. So we launched this program in 2010. With a series of assessments that needed to take place and an operations research to shift the tasks from facilities with surgical ability to facilities without surgical ability, because we were introducing misoprostol as a technology to treat incomplete abortion and miscarriage. So it is very important for the work that we do, and specifically for VSI, that we institutionalize the processes and services. So we work extensively in the design of training materials, clinical guidelines, and protocols that need to be validated with the technical working group and then later on with the management of Ministry of Health. So it's part of the policy and practice documents in the country, specifically in this case for comprehensive services that include treatment of incomplete abortion, miscarriage, and post-abortion family planning. We integrated MVA, so the comprehensive package has 2 technologies. And I'm happy to report that in 2014, so beginning of 2014, we actually have currently 23 districts out of the 30 districts in Rwanda that have comprehensive PAC services included. So moving into safe abortion services, I mentioned that the penal code changed in 2012 that now includes provisions for women that are victims of rape, incest, forced marriage, and to save the life of a woman, or in cases of fetal impairment. Now, what we did in order, so what do you do? So the law changes, so what happens next? So what we did as part of the process is to conduct in-depth interviews with the stakeholders to gather from them what their feelings are about the penal code and how can we together, including the civil society and the Ministry of Justice, Law Enforcement, Ministry of Health, and all of development partners working in reproductive health, how to basically operationalize what the law said. And then we then conducted a first stakeholders meeting where we discussed and priority areas of interventions were identified, such as capacity building, the importance of involving communities and civil society, and also to have a strong monitoring and evaluation as priorities. So because we didn't have in the first stakeholders meeting voices from women and girls that are potential clients of these services, utilizers of the services, we also conducted focus group discussions, one with the young women and one with the mothers, and presenting the results in the second stakeholders meeting, where we basically, during that meeting, finalized a guidance document for Rwanda on how we were going to to implement the changes that were brought about by the changes in the penal code. So there's still many activities, and I'm not going to go into the details that we are still conducting in 2014, but we're very committed that no matter the challenges, and trust me, there are many, that even when providing safe abortion services within the context, within the framework, the legal framework that exists, is still very challenging for women. And I'm just going to give you 1 second to look at this picture of how the women go into the process, the potential beneficiaries, who they need to see in terms of law enforcement and the police. They can go directly to the judiciary, but there are other supporting actors such as psychosocial and legal and financial. Before even they access sometimes the health system where the service itself, the clinical service, is given. So it is a challenging environment. We are collecting a tremendous amount of data to identify the gaps in the system so that together with both Ministry of Justice, Ministry of Health, and law enforcement, we can, within the legal framework, provide safe abortion services for women in Rwanda. Thank you very much.